What is lymphoma and how does it relate to reproductive cancers? Imagine your body's immune system as a busy network of soldiers fighting off infections. Lymphoma is a type of cancer that starts in these soldiers, called lymphocytes, which are a kind of white blood cell. These cells are part of your lymphatic system, which helps fight illness and keeps fluids balanced in your body. When lymphoma develops, these lymphocytes begin to grow uncontrollably, forming tumors mainly in lymph nodes. These are small, bean-shaped structures found throughout your body, including areas near the reproductive organs like the groin. There are two main kinds of lymphoma. One is Hodgkin lymphoma, which is identified by the presence of Reed-Sternberg cells under a microscope. The other is non-Hodgkin lymphoma, which includes many different subtypes affecting various lymphocyte types. Because lymph nodes are spread all over the body, lymphoma can appear in many places, sometimes near reproductive organs, but it does not originate in the reproductive tissues themselves. Reproductive cancers, like testicular cancer in men or cervical cancer in women, develop from cells in the reproductive organs. These are distinct from lymphoma because they start in tissues such as the testes or cervix. However, lymphoma can sometimes involve lymph nodes close to reproductive organs, especially in the groin area, which might cause swelling or discomfort. This can sometimes make it tricky to tell apart from symptoms of reproductive cancers, but they are different diseases with different origins. Rarely, lymphoma can originate in or spread to reproductive organs, but this is uncommon. Since lymphoma is classified as a blood cancer, it involves lymphocytes circulating in the blood and lymphatic system. Treatment for lymphoma usually involves therapies that target these immune cells, while reproductive cancers often requiring surgery, radiation, or specific targeted treatments for the affected tissues. Understanding the biology of lymphoma helps clarify that it is a cancer of immune cells, not reproductive tissues. While both lymphoma and reproductive cancers can affect the same general area, they are fundamentally different diseases. Recognizing these differences is important for accurate diagnosis and effective treatment. If you notice any unusual swelling or symptoms near your reproductive organs, it is essential to consult a healthcare professional for proper evaluation. Always seek personalized medical advice to understand your health situation fully.